എല്ലാവർക്കും സാന്ത്വനത്തിലേക്ക് ഹാർദമായ സ്വാഗതം. It's with a lot of happiness that we at Bhavana Jyothis Puttur Diocese and Women's Commission present you this event. We also wish all the women a happy Women's Day. Thank you. ഇന്നത്തെ ഈ ഇവന്റിൽ ജോയിൻ ചെയ്തതിനും നിങ്ങളുടെ ഹെൽത്തിന് മുൻഗണന കൊടുത്തതിനും അങ്ങനെ തന്നെ ഈ ഇവന്റിൽ ജോയിൻ ചെയ്ത എല്ലാ പുരുഷന്മാർക്കും a big shout out and thank you. Your understanding and support means a lot to the women in your lives. Now, what is Santwanam? Santwanam literally means comfort. We can think of it, or we can conceptualize it as a capsule. In capsule, there are three parts. Aditya part is blessing. Blessing from Lord Almighty and His grace. The second part is the science, research, and how should we prevention, care, cure. And the third part is what we as a community, namata kootayimayude strength. So these are three parts of Santwanam. Adhigam deerghipikande, I'll start with a prayer. Request all of you to please fold your hands and close your eyes. A reading from the Gospel of Matthew, verses 14 to 17. When Jesus entered Peter's house, he saw his mother-in-law lying in bed with a fever. He touched her hand, and the fever left her, and she got up and began to serve him. That evening, they brought to him many who were possessed with demons, and he cast out the spirits with a word and cured all who were sick. This was to fulfill what had been spoken through the prophet Isaiah. He took our infirmities and bore our diseases. Thanks to Lord our God. Let me request my colleague and our secretary of Bhavana Jyothis Puttur, Jisha Joy, to address and welcome the gathering. Over to you, Jisha.
Good evening, very good evening to one and all assembled here. So, let me just begin with my job to welcome each of you to this great evening. So, Most Reverend His Excellency Abun Marmakarius Pidave, our chief speakers for today, our own dear panel of doctors, very Reverend Monsignor Father Elder Puttur Kandatilacha, Reverend Fathers, Sisters, my dear mothers, the youths and MCA members from different churches have joined us. I'm more than grateful to be here to welcome all of you today to Santwanam, a cervical cancer awareness program. First of all, let me thank Almighty for this opportunity, and thanks to each of you for investing your valuable time today on a Saturday evening with us. Let me take the honor to welcome our own dear patron, His Excellency, Most Reverend Givargis Marmakarios. Abun is the chairman for Women Commission for KRCBC and also the Metropolitan for Diocese of Puttur. Pidave, your presence has always been a great blessing for us. Hearty welcome to Santwanam. Next, we have our own vibrant panel of doctors who will be sharing their valuable insights in a few minutes. Let me welcome Dr. Priya Abraham, who is also known as a women scientist leading India's the fight against COVID-19. She's also a professor in Department of Clinical Virology at CMC Vellore. Ma'am, we are privileged to have you as a chief panel. Hearty welcome to Santwanam. We also have esteemed presence of Dr. Pallavi VR, who is also professor of HOD Gynecological Oncology at Kidwai Institute of Oncology, Bengaluru. On behalf of Bhavana Jyothis Puttur Diocese, I wholeheartedly welcome you, ma'am, to Santwanam.
Thank you.
Next, let me welcome our own dear Dr. Madonna Stephen. Doctor is a member of Henor Parish, and also she is a leading consultant for anesthesia and chronic pain management at Sparsh Hospital, Bangalore. Doctor will be our moderator for today, and she'll be introducing our doctors in more detail. Dear Doctor, we wholeheartedly welcome you to Santwanam.
Thank you.
We have our other priests, directors, sisters, animators who've joined us from various religious forums and dioceses. Hearty welcome, dear fathers and sisters. Thank you for joining us. Next, I would like to welcome our own pillar of support, our dear father, John Puthankandathil, the director of Bhavana Jyothis, the Commission for Women for Puttur Diocese. Achan has been our mentor throughout the planning of the event. Acha, I wholeheartedly welcome you to this event. We also have the presence of Sister Nancy, who is the Secretary for Women Commission KRCBC. Sister, hearty welcome. May I also welcome Mrs. Usha Manoj, who is the President for Bhavana Jyothis Puttur Diocese, and Mrs. Tangam George, the Joint Secretary for Women Commission KRCBC. Hearty welcome, Usha Chechi and Tangam Chechi. Lastly, let me take the pleasure to welcome the most important group, the audience, the mothers, the youths, the MCA members who've joined us from different forums. I welcome each of you on behalf of Bhavana Jyothis Puttur Diocese. May Almighty bless us all with many more such events that can, actually help us serve the society better. Hope all of you have great insights from the session today. Thank you.
Thank you, Jisha, for that heartwarming welcome. Let me now invite our patron, His Excellency Abun Mar Makarios, to please bless us with prayer and inaugurate SANTHWANAM.
Good evening to all of you. You can hear me, no?
Yes,
Yeah,
Pedami,
God
good evening.
bless you all. It's really a wonderful moment in which we are gathered in a virtual way to treat an important aspect of our normal human life. First of all, I congratulate Bhavana Jyothis, the Family Commission and the Women Commission Director, Father John Puthankandathil, and all his team, Usha, Tangam, and all other leaders, Anu, all those who are connected with our family as well as Women Commission. It's really one of the initiatives that uh, gain our special attention. And you have succeeded in getting three eminent, so to say, doctors, Dr. Madonna Stephen, Pallavi you are, and Priya Abraham. All of you are well versed in your different concerned departments. This is going to, your interventions, your guidance are going to help our normal mothers. So I congratulate you and thank you in a special way for making this opportunity and making yourselves available to our people on this virtual media. We know health is wealth. Right in the beginning, we have listened to the word of God, where Jesus heals the mother-in-law of St. Peter, and immediately after she moves to service. So health is meant for service. Health is wealth, and that is one of the primary concerns of our human existence. In nowadays, different types of diseases are uh, coming into our normal life. So recently we have H3N2. So we have never heard of it. So new ways and types of number of uh, unbecoming or unwanted elements are creeping into our normal human life. How could we safeguard a better physical condition, health, etc. are very important. And through this virtual media, now it is a opportune time as we think of especially the theme cervical cancer, mainly pertaining to our women flock. I wish you all the best. God bless you. I welcome all our fathers, all our members, those who are uh, somehow involved in this virtual gathering. In a special way, I welcome our Vicar General, Dr. Elda Pundangratil, and all other fathers who support our women flock to come into the mainstream through this way. I wish you all the best. God bless you. I don't want to take much time because the doctors are there, people are there, they have their own needs maybe, and so on. God bless you. Thank you.
Thank you, Pidave, for the kind words. Let me hand over to Usha Chechi for the president of Bhavana Jyothis, Puttur Diocese, to please give the felicitation.
His Excellency, Most Reverend Dr. Givargis Marmakarius, the Chairman of the Women's Commission in Karnataka and the Bishop of Puttur, Reverend Fathers, Reverend Sisters, ladies and gentlemen, and my dear friends. Good evening to all. As His Excellency quoted in his inaugural address, good health is one of the main elements of happiness we need in our lives. All of us strive for a healthy lifestyle since it allows us to live life to the fullest with meaning and purpose. Amidst this, all of us are aware that people are suffering from different kinds of diseases, and cancer is the leading cause of death in the world. But cancer survival rate may improve many types of cancer due to increased awareness of cancer screening, available advanced treatments, and mainly prevention. With this regard, Puttur Diocese Bhavana Jyothis Commission for Women is conducting cervical cancer awareness program SANTHWANAM. I am immensely happy to thank all of you for the wonderful participation. I wish and pray let this event provide all of us SANTHWANAM, one sort of empathy, relief, peace of mind and health. We are blessed to have a panel of well-experienced, spiritual, wonder women doctors to discern this journey. Through this event, let the Women's Day celebration flourish, nourish, and pertain to meaningful life. ಉತ್ತಮ ಆರೋಗ್ಯ ಮನುಷ್ಯನಿಗೆ ಸಂತೋಷ ಹಾಗೂ ಶಾಂತಿ ಸಮಾಧಾನ ನೀಡುವಂಥದ್ದು. ನಾವೆಲ್ಲರೂ ಆರೋಗ್ಯವಂತರಾಗಿರಲು ಹಾಗೂ ಅದರ ಮೂಲಕ ಪ್ರಜ್ಞಾವಂತ ಪ್ರಜೆಗಳಾಗಿ ಬಾಳಲು ಶ್ರಮಿಸುತ್ತಿರುವವರು. ಹೀಗಿದ್ದರೂ ಹಲವು ರೀತಿಯ ರೋಗಗಳಿಗೆ ಮನುಷ್ಯನು ತುತ್ತಾಗುತ್ತಿದ್ದಾನೆ ಹಾಗೂ ಪ್ರತ್ಯೇಕವಾಗಿ ಕ್ಯಾನ್ಸರ್ ಎಂಬ ರೋಗದಿಂದ ಮರಣ ಹೊಂದುವವರು ಅಧಿಕ. ಈ ರೋಗದ ಬಗೆಗಿನ ಅರಿವು, ಜ್ಞಾನ, ಜಾಗೃತಿ ನಮಗಿದ್ದರೆ ಆರೋಗ್ಯವಂತರಾಗಿರಲು ಸಾಧ್ಯ. ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಪುತ್ತೂರು ಧರ್ಮ ಪ್ರಾಂತ್ಯದ ಭವನ ಜ್ಯೋತಿಸ್ ಮಹಿಳಾ ಆಯೋಗವು ಸರ್ವಿಕಲ್ ಕ್ಯಾನ್ಸರ್ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮ ಸಾಂತ್ವನಂ ಎಂಬ ಶೀರ್ಷಿಕೆಯಡಿಯಲ್ಲಿ ನಡೆಸುವ ಈ ಜಾಗೃತಿ ಕಾರ್ಯಕ್ರಮವು ಎಲ್ಲರಿಗೂ ನ್ಯಾಯೋಚಿತವಾದ ರೀತಿಯಲ್ಲಿ ಸದುಪಯೋಗವಾಗಲಿ ಎಂದು ತುಂಬು ಮನದಿಂದ ಹಾರೈಸುತ್ತಿದ್ದೇನೆ. ശാരീരികവും മാനസികവുമായ ആരോഗ്യമാണല്ലോ നമ്മുടെ ഓരോരുത്തരുടെയും പ്രധാനമായ സമ്പത്ത്. എന്നാൽ തിരക്കേറിയ ജീവിതം എല്ലാം വിസ്മരിപ്പിക്കുന്നു. പക്ഷേ നാം തിരിച്ചു വരേണ്ടതുണ്ട്, നമ്മുടെ ആരോഗ്യം കാത്തു സൂക്ഷിക്കേണ്ടതുമുണ്ട്. അതിനാൽ സാന്ത്വനം എന്ന ഈ സംരംഭം എല്ലാവർക്കും പ്രയോജനപ്രദമായി തീരട്ടെ എന്ന് ഹൃദയത്തിന്റെ ഭാഷയിൽ ആശംസിക്കുന്നു. ഇനിയും മുന്നോട്ടുള്ള ആരോഗ്യപരമായ സംരംഭങ്ങളിൽ കണ്ടുമുട്ടാം എന്ന പ്രതീക്ഷ നമ്മുടെ ഓരോരുത്തരുടെയും ഹൃദയത്തിൽ കാത്തു സൂക്ഷിക്കാം. വിഷ് യു വെൽ ആൻഡ് ഹാവ് എ സ്പ്ലെൻഡിഡ് ടൈം.
David. Thank you, Usha Chechi. Let me now introduce our moderator for the panel, Dr. Madonna Stephen. Dr. Madonna Stephen is one amongst us. She's a member of the Hindu Church and a member of the Madhur Jyothis there. Dr. Madonna is a consultant anesthetist and chronic pain management at Sparsh Super Speciality Hospital, Infantry Road, Bangalore. After completing her MBBS from Sri Siddhartha Medical College, Tumkur, she postgraduated in anesthesia from Father Mullah Medical College, Bangalore. She secured a gold medal in anesthesia from Rajiv Gandhi University of Health Sciences and has worked in onco anesthesia at Kidwai Memorial Institute of Oncology. apart from being certified in the essentials of palliative care and being a fellow in chronic pain management, she's also been awarded European Diploma in Regional Anesthesia. Over to you, Doctor.
Thank you, Anu, for those kind words. A very good evening to one and all. Let me begin by introducing our illustrious speakers for this panel. We are indeed honored to have with us two very illustrious speakers who have decades of experience and knowledge in the fields of gynec-oncology and virology. To begin with, we have with us Dr. Pallavi VR, the professor and head of the Department Gynec-Oncology at the prestigious Kidwai Memorial Institute of Oncology. She received her training in gynec-oncology at KMIO, followed by training in laparoscopic surgery and robotic surgery. She received her robotic surgery training at the Center for Advanced Simulation and Education in Istanbul. She is trained in essentials of palliative care as well. Ma'am has won several awards, Hamsa Award, Women's Excellency Award 2021, to name a few. She's been a guest speaker and at lectures all across the world and has several papers to her credit. Ma'am, it's an honor to have you with us here today. Thank you for being with us.
Thank you, Madonna, for your kind words.
Our next speaker is the renowned virologist. As introduced, the woman scientist who led India's battle against COVID-19. Please welcome Dr. Priya Abraham. Madam is currently the professor at the Department of Clinical Virology at the prestigious CMC Vellore. She was a former director of ICMR, National Institute of Virology, Pune, when the COVID-19 pandemic hit India. She has also been recipient of several awards, the Business Excellence and Innovative Practices Academia Award, Janani Award for Medical Research Leadership, Sharda Shakti Award, to name a few. She is a member for the National Department of Biotechnology's Task Force on Human Papillomavirus and Vaccine, and is also the life member at the Indian Association for Cancer Research. Welcome, ma'am, and a big thank you and kudos to you and your team for handling the COVID-19 pandemic for us. Thank you so much for being here with us today.
Thank you very much, Dr. Madonna. It's an honor to be here, truly. But I might have to log out by 7:45 because I'm taking a flight.
No, I understand, ma'am. Thank you so much. I know you're traveling. Thank you for being with us. And I'm sure your input for whatever time it is extremely valuable to us today. So let's begin. Well, as we all know that cancer today is the leading cause of morbidity and mortality. And when it comes to cervical cancer, we know it's a cancer that can be A, prevented, and B, when timely treated after diagnosis, it's a battle won. So it's more relevant now than ever. So now, what is cervical cancer and why are we talking about it? Can I request Dr. Pallavi to take on that for us?
Yeah, thank you, Madonna. As you rightly said, cancer is one of the leading cause of death among women, especially the cervical cancer, which is one of the second most common cause of cancer among women. If you take our Indian statistics, you see among every 10 women, 1 woman dies because of this cancer. Cervical cancer is very important because it's a preventable cancer. And this is the only cancer in the body which has a causative organisms. Like that cervical cancer is caused by a virus. Unlike the other cancers where you don't have a definitive cause. Here it is because of the virus, human papilloma virus. So the awareness about the cervical cancer and the timely testing of the cervical cancer is very important because it has a long incubation period. Like once the woman is infected with the virus, the cancer doesn't happen overnight. That is what everybody should know, that it takes about 7 to 8 years to become a full-fledged cancer. So every woman has this many time with her, this many years with her to get it tested, treated, or get it detected in an early stage or in a pre-invasive stage. So I think every woman should come out of the hesitation for getting this tested or screening, and it's very important that everybody knows about the screening program of cervical cancer. It is a preventable cancer, so primary prevention is always better than your secondary prevention.
Absolutely agree with you on that, ma'am. Like as Dr. Pallavi mentioned, ಈ ಕಾಯಿಲೆಗೆ ಕಾರಣ ಇರೋದು ಒಂದು ವೈರಸ್. ಬಟ್ ಯಾವ ವೈರಸ್? ಇತ್ತೀಚೆಗೆ ಆಫ್ಟರ್ COVID-19 ನಾವು ಎಲ್ಲರೂ ವೈರಸ್ ಬಗ್ಗೆ ಕೇಳ್ತಾ ಇದ್ವಿ. Lot of information has come out. But we've heard about COVID-19 virus, H3N2 virus, H1N1 virus. But ಈ HPV virus ಏನು? ಇದ್ರ ಬಗ್ಗೆ let's hear it from Dr. Priya Abraham.
Thank you, Dr. Madonna. Actually, as rightly pointed out by Dr. Pallavi, 99 to 99.5% of all cervical cancers. This is a cancer that affects the neck of the uterus. And 90 to 95% of all cancers that occur in this region are caused by a virus known as a human papilloma virus. It's a very small virus, and about 40 such types infect the genital passage. It can infect men and women, but women are very prone to, if they have chronic or persistent infection with this virus, few years down the road, as Dr. Pallavi had said, maybe 6 to 8 to 10 years down the road, they can develop cervical cancer. The virus is transmitted mainly through close skin to skin or mucosal contact, and today is believed to be largely transmitted through the sexual route. But even skin to skin contact, even mother to child, if a mother has any of these, some of these HPVs known as HPV 6 and 11, which causes warts in the genital region, the baby born from the genital passage can also pick up this infection.
Absolutely, ma'am. Now, as Madam rightly said, there are various modalities as to how it's spread. But what are we looking at in terms of a risk population? Now, who is at risk for cervical cancer?
The question is to whom? Me?
To you, ma'am.
Okay, so basically, as I just mentioned, it is now identified as one of the most common sexually transmitted infection. And, you know, up to 80% of women in their sexually active age can pick up this infection because of sexual activity. And many women will clear the infection spontaneously. It's a minority, 1 to 2% of women who get infected, who, if they have a persistent, that means a long-standing infection with this virus, can it start producing changes in the cervical region of the uterus, the cervix.
Thank you, ma'am. Now, I wanted to direct this question to Dr. Pallavi. Like, when does a woman know when should she get tested, or what are the signs or symptoms that she will see if she has cervical cancer?
Yeah. Like Dr. Priya has already told about the risk factors, like most of the women during the reproductive age group or when they're sexually active do get infected with this virus, but most of them regress. That means the infection will come down on its own, and only few, 1 to 2% will have progression with this infection. So in this 1 to 2%, it is those women who are at risk. So who are the women who are at risk is like woman or a girl who has started her sexual life very early, like at the age of 14 years, 15 years, 16, or less than 20 years. Let's make it as less than 20 years. So these girls or these women are at very high risk of developing a pre-invasive cervical lesion or a carcinoma, cancer of the cervix. So that is one thing. And women who have had too many children in a very short interval at a younger age group. So, and with women who have multiple sexual partners. So these are the most important risk groups who will develop this viral infection, and this will develop on to become a cancer. So not every woman with HPV infection will have a cancer. This has to be remembered. And whoever have had the sexual intercourse early in life should get it tested once they're at least 30 years. Because in India, we don't have a set screening program like the WHO screening program in India, like the West. So every woman in at least once in their lifetime at the age of 35 should get a pap smear testing done to get this virus detected.
Absolutely. I think it's a big message to all the women out there that once you are crossing the age of 30, like Madam said, at least at 35, ನೀವು ಹೋಗಿ pap smear ಮಾಡ್ಕೊಳ್ಳಿ. It's always going to be beneficial on the long run. We have a lot of hesitation in our community when it comes to getting tested, but this one test affects your lifetime and affects your
Yeah.
family. So we should just go ahead, and we should encourage the other women in our family as well to go ahead with it. So
And
I
one more
want
thing
to
the woman should know is pap smear test is not painful at all. It is not painful at all. It might be a little uncomfortable for a pelvic examination, but pap smear is nothing to get scared. It is not painful at all. It is just takes hardly 2 minutes. So I think if every woman makes up their mind, they can prevent cervical cancer in India.
So true, ma'am. If you could just elaborate on where can they get a pap smear done as well, ma'am?
The pap smear is available in most of the hospitals and most of the clinics. It's only in the rural setups where pap smear can be done, but then you don't have a lab or a pathologist to give the report. That's when you need a higher center to report these pap smears. So pap smear can be done in most of the thing, and it is not very expensive. If you go to a government setup, it is hardly 50 rupees. Or if you have a BPL card holder, then most of the government hospitals will do it free of cost. Most of the PHCs, government hospitals, district hospitals do free of cost.
Oh, that's fantastic.
Yeah.
So to Dr. Priya, now could you please elaborate more about what is this pap smear test? So what are the other tests to detect this HPV virus?
So there are three important modalities of screening for any changes in the cervix that could predispose to developing cancers. One is called a visual inspection with acetic acid, where you swab the cervix with dilute acetic acid like vinegar. You just swab the surface, and if the tissue is abnormal, it turns white in the region of the cervix. The second is the pap smear, which Dr. Pallavi had mentioned. It's inexpensive, and it has been time tested. The only problem is in rural settings and in resource limited settings, the quality, the inter-observer variation can be very different. So, there could be subjective variation in the interpretation of the pap smear if people are not trained to look at the abnormal cells. What is pap smear? You swab the cervix and you look for abnormal cells after staining that slide. Those abnormal cells are known as coilocytes, and you look for those abnormal cells. But if you have to have some amount of training for that, and there can be subjective error, interpersonal differences in how we interpret that slide. The third and most recent way to screen for cervical cancer is to look for the causative virus, where we look for the viral DNA. When we look for the viral DNA, again we swab the cervix and we put it into a liquid medium, and then we put it through some there are a whole array of tests, different types of tests that can look for HPV DNA. DNA is the seat of the genetic material of the virus, the core genetic material of the virus, and we look for the HPV's DNA. A variety of tests are available today. The problem with HPV DNA is it is right now still too expensive for the average woman, or especially those from a low resource or lower socioeconomic setting. But today, it is recommended by WHO as the primary screening tool for cervical cancer.
അപ്പം എല്ലാവരും ഒരു pap smear consider ചെയ്യണം, like how Dr. Priya has advised. It's a simple test, it's a painless test, and you can walk into a nearby hospital and get it done. It's a matter of those half an hour effort that you take, which will make so much of a difference നമ്മൾ എല്ലാവർക്കും. അപ്പം madam, Dr. Priya, as you suggested, which one of these three tests would you recommend to the average general public? ഇപ്പം if a lady walks up and says, what test ഞാൻ എപ്പോൾ ചെയ്യണം, എന്ന് ചെയ്യണം, എത്ര പ്രാവശ്യം ചെയ്യണം in a lifetime?
Okay, so as per the World Health Organization's recommendation today, as Dr. Pallavi said, women after 30 years, at least by 35, they must have one screen, and then next, at least by 45, This is the basic targets that women should be screened at least twice in their reproductive lifetime for this virus. And pap smear is a time-tested one, but there are some limitations. It is little lower in sensitivity. DNA is amenable to automation. That means intersubjective errors don't happen, but it is more expensive. And I think the need of the hour is, if you want to make HPV DNA a primary tool, it has to become more affordable in our country. Right now, it is not.
So we have 3 modalities available, and it's available very close to you, probably the nearest hospital next to you. Please go in and make the effort to get tested, get the other women in your house tested. Well, that is what the message here is. Now, we know so much about these modalities of testing and going and getting a pap smear done. We will just quickly cover into the vaccination section, because I think madam has to leave a little by around 7:45. So as we started the session by saying, it's a preventable cancer. So early detection we covered using the pap smear and the other modalities of testing. Now prevention is better than cure. അത് നമ്മളെല്ലാവരും ഒത്തിരി പ്രാവശ്യം കേട്ടിട്ടുള്ളതാ, but sometimes we don't really put it into use. But when it comes to this cancer, prevention is way better than cure, and it's a simple vaccine. Now vaccine kind of karyam parayumbo ellarum we have a little hesitation. New vaccine effect cheyu, is it worth it, etra side effects undu, it's not been there for so many decades, like how we know OPV or BCG is there, nammal ellarum pillarkum kodukum, we don't think about it. When it comes to starting up getting into a new vaccination program, we have a lot of hesitation that comes into it. So if I could just have Dr. Priya elaborate a little bit about the vaccine that is available.
So actually, Dr. Madonna, this vaccine is relatively new to our country, but it was launched as early as 2006. So we're talking about almost, 19 years, not 19, 17 years of the existence of this vaccine. It is to be given. Actually, the whole idea is, as you mentioned, prevention is better than cure. So the vaccine should be given to girls before they reach their adolescent years. So it's ideally to be given to pre-adolescent girls between years 9 to 14, so that they develop antibodies, immunity against this virus. And even if once they become sexually active, they encounter the virus, they have enough immunity to ward off or to prevent the infection. So if we want to think of it as a national program, we should advise mothers to get their young daughters at the age of 9 to 14, ideally, to be vaccinated before they are likely to become sexually active. That way, the primary prevention will be most effective.
And how many vaccines are we looking at, madam? Is it once in a lifetime, or do we have to repeat it?
Okay, so today, earlier when the vaccine was launched, they recommended 3 doses of the vaccine. Today, with studies, even WHO recommends only 2 doses of the vaccine. And in fact, now studies are going on to see whether even a single dose will be sufficient. But by and large, for most vaccines that are available today, there are 6 to 7 different companies providing this vaccine. 2 doses are required, and it should be ideally given, as I said, very young, as a girl, before she becomes sexually active. But it can be given even to a 20-year-old or 25-year-old. But the benefits are less if she has already become sexually active. So catch them young and vaccinate them with 2 doses. If the woman is older, then maybe it is better to give an additional dose. Or if the woman has some reason for being immunosuppressed, we have some women we know who are HIV infected, for instance. Those women will need full 3 doses of the vaccine, because their immunity is somewhat suboptimal or lower than an average person. So we don't stop at 2 doses. We advise 3 doses of vaccine for them.
And ma'am, where are these vaccines available, or how expensive are they?
Okay. So the vaccines right now is available mostly only in a private setting and in medical colleges. And if we go for the vaccines that are marketed by multinationals, it can vary. The cost can vary anywhere between 1,800 to 3,000, 3,200, depending on the hospital. Some private hospitals, they charge a little extra. But the good news for you is that this year, in perhaps June or July of this year, the Indian vaccine made by the Serum Institute of India in Pune, the vaccine has been launched and it will be introduced as part of the national immunization schedule. And the cost, as told by the Mr. Adar Poonawalla, the person who owns Serum Institute of India, he is aiming to keep the cost between 200 to 400 rupees, which is, almost tenfold less than what the cost is. What I earlier told you, easily 2,000 rupees. So that is the good news. It's going to become part of our immunization schedule. So all mothers and young women and mothers of young girls must be watching this page. It's going to be launched latest by July of this year.
That's fantastic. I think this talk couldn't have come at a better time. We should keep reiterating to the public that by July we have a cheaper and more efficient and Indian vaccine coming up. And we have seen what difference a vaccine makes. I think after COVID, everybody really realized how different, how effective a vaccine is and how much of our lives individually it can affect. So couldn't hear it. I mean, it's a better, fantastic news to hear. So, ma'am, a lot of people will be wondering about the efficacy of a vaccine because we haven't seen it in the public in India. We've not, it's not time tested in the Indian public yet. So,
Okay. So the efficacy of this vaccine has been, because it's been around from 2006, they have looked at the burden of, these pre-cancer lesions in the cervix, pre-cancer changes in the cervix, and the number of women who might come as HPV positive. And they have found in most countries where vaccination became a national program, like Australia was one of the countries that really ran with it. They not only vaccinated the young girls, they have almost completed the vaccination of the boys, because boys too can transmit or acquire the infection. They have found that in women, 70 to 80%, maybe even more than that, of these pre-cancer lesions have come down tremendously. There's a marked drop in the pre-cancer and cancer lesions in countries where this vaccine was introduced. So the efficacy is very good. The amount of antibody that a vaccinated girl or young boy produces is humongous. It's 10 times the normal amount of antibody somebody will produce even after a natural infection. Minimum 10 times higher.
so ma'am, are we recommending this vaccine for the boys too? If so, at what age?
In India is not ready to handle that, because just to vaccinate the number of girls in our country will be a humongous job. But with time, once this is launched, with time, India hopefully will catch up and then extend it to the boys. The girls are more vulnerable with this infection. So girls will be our target group first, and maybe 5 years down the road, we will see our boys also getting vaccinated. We are a little behind the curve compared to countries like Australia and the UK, etc. US.
All right, that's good to hear. So, to all our viewers and audiences, this is going live on YouTube. If you have any questions, നിങ്ങൾ എല്ലാവർക്കും യൂട്യൂബിന്റെ അടിയിൽ comment section please put your questions and we will put it forward to our esteemed panel. They would love to take it for you. So go ahead. Any queries, please put it in the comment section on the YouTube live. Now, what are the long-term side effects or any side effects that have been observed by this vaccine, ma'am?
There have been no serious side effects due to this vaccine. The usual pain, the tenderness at the site of vaccination. Some people have had fever, mild fever. Of course, when you vaccinate young girls, they are likely to be anxious. So initially, there were cases where girls fainted. It may be also, psychologically they were anxious. So, there were some episodes of fainting and after taking the vaccine, but I think it was more psychological than caused by the vaccine itself. It is recommended that those who have got any allergy to yeast, because most of these vaccines are made from yeast cells, the yeast that we put when we make appam,
Yes.
that kind of yeast. So those who are allergic to a species of yeast should not actually take the vaccine, or should take physician's guidance before they take the vaccine. But that will be a minority. So allergies are very rare. Some local symptoms and maybe fever or slight body ache is what, if at all it is there. But for the large majority, a very safe vaccine and an efficacious vaccine too.
Thank you, ma'am. I know this vaccine is very close to your heart. We can sense your passion from the airport right there. So I hope it reaches the public. Can't wait for this to be a part of the vaccination schedule in India. So now, Iga, we've spoken about what is cervical cancer, how do we detect it, or what are the tests and the vaccines, and how we can prevent it. Suppose you have gone for a test and pap smear report positive. Ini nammal endo cheyano. For that, let's move on to Dr. Pallavi. Ma'am, what would one do if the pap smear is positive?
See, pap smear positive means you have a cellular abnormality. Pap smear very rarely, when you do a pap smear when there is no lesion on the cervix. That means to say there is no tumor growth over there. You're doing a pap smear for patients who are symptomatic, like symptoms like chronic white discharge. White discharge can be common in most of the women when they're in the reproductive age group, but when you say it is an abnormal discharge, like when you have change in the color of the discharge, usually normal physiological discharge will be white in color, which is more common before the cycles and after the cycles. That means to say periods munche, periods aad mele. You'll have some kind of watery discharge or white discharge, which is normal. But when you have change in color, when the discharge turns green or it is yellowish in color, it is abnormal. And when discharge is foul smelling, when you have smell from the discharge, it is abnormal. And when it is associated with itching, it is abnormal. When a woman has this persistent abnormal white discharge, then she has to get treated and then get a pap smear done. So these are the people where we advise they should undergo for pap smear. Or if they have intermenstrual bleeding, that is when they have bleeding in between the two cycles. In between two cycles, if they have bleeding or spotting, or after the sexual intercourse, if they have bleeding, then these are abnormal things. So these are the people whom we suggest that they should go in for a clinical examination or cervical examination. So when you do such things, when a person comes, if there is an obvious tumor or a growth, you don't do a pap smear. But when there is cervix looks normal or congested, then you do a pap smear. This pap smear usually detects whether she has a propensity or whether she has chances of developing a cancer, like pre-invasive lesions. This lesion is the lesions which will develop into cancer if you leave it untreated. So this is very important. So when you pick up in a pap smear that they have a pre-invasive lesion or they have a high-grade changes like CIN2 or CIN3, then these are the patients whom we tell them to either undergo a HPV testing or we do a colposcopy. Colposcopy is nothing but visualizing the cervix under the microscope. Okay, you see the cervix under a microscope and you take a biopsy to see whether they have developed cancer or it is still in the pre-invasive lesion. So this is a basic test what we are going to do. And supposing somebody has done a pap smear and it's showing already as squamous cell carcinoma, it's already showing tumor cells in that, then you're going to take a biopsy from that growth and then we tell the patient for the investigation and you see in which stage the patient is and then treat accordingly.
So please remember, if there is any bleeding in between the cycles, Madam Barnole, any discharge smell on the discharge and the color change or any difference from what is regular to you, please go ahead, meet your nearest gynecologist, or a pap smear cheva, colposcopy cheva. These are simple procedures which can be done in OPD. Pinite admit avande avashyamilla. Ningal poite consult cheyidittu appam cheyidittu varanullade ullu. And if you have a positive pap smear, please go ahead and meet your nearest gynecologist and they'll take it forward from it. Do not have these symptoms and neglect it, because നമ്മുടെ population, we have a lot of hesitation, especially when it comes to gynecological or urological procedures. നമ്മൾ പലപ്പോഴും we hesitate, we don't tell the members in the house, ഫാമിലിനോട് പറയത്തില്ല, വെളിയിൽ ആരോടും പറയത്തില്ല, ടെസ്റ്റ് ചെയ്യാൻ മടിക്കും. You will think, let's put it off till a stage where it is really bad. Go ahead, test ചെയ്യുക. Even if it's positive, നമുക്ക് variety of treatments available ഉണ്ട് based on what your staging is. Madam പറഞ്ഞ പോലെ pre-cancerous. So if you catch it at that, your odds are much better. So now, as Madam said, a variety of treatments are available based on the stages and variety of tests. Dr. Pallavi, if you could just briefly give us an insight as to what is the treatment or what does the journey forward look like?
Yeah. And one more thing, Dr. Madonna, one more thing which I didn't mention previously is postmenopausal bleeding. Once the woman has stopped bleeding and she has any kind of bleeding, even a small spotting, a bleeding for 1 day, or she has continuous bleeding, even a bleeding or a small blood stain discharge should be investigated. You cannot think, many women think it could be because of some kind of heat in the body or some kind of food they've eaten, but that is not so. These are all myths. So you have to get it tested, no matter what. Even if you have one episode of bleeding after you have stopped menstruating, it is very important for every woman to undergo a testing to see why she had that bleeding. Most of them don't come for testing thinking that it is normal, or they think they must have started menstruating again. What I hear from my patients regularly is it could be because of some kind of food, heat, cold the body has, but that is not true. So I'm stressing again and again that postmenopausal bleeding should be investigated, no matter even if it is for once. It has to be investigated. Even if you have had bleeding for 1 day, it has to be investigated. So once you have been diagnosed that you have a pre-invasive lesion or a cancer, then depending on the pre-invasive lesion, whether it's high grade or low grade lesions, usually you can keep them on follow-up. High grade lesions needs to be investigated. Either if the woman is reliable for follow-up, then you can do a cone biopsy. That is, you remove the mouth of the uterus and then keep them on follow-up. If they are not a reliable person for follow-up, or if they have completed their family, they can go in for a simple hysterectomy, that is removal of the uterus. But if it is a cancer, then they need a bigger surgery like a radical hysterectomy along with the pelvic node dissection. Nodes are something like the lymph nodes where you can have the disease. So that has to be done to do a complete staging and see which stage they fall into. And depending on that, we treat them with adjuvant therapies like radiotherapy or chemotherapy if needed.
And ma'am, could you just briefly give an insight as to which centers are available, or where can, like, we have people from Dakshin Kannada also joining us, so they need to know where can they go to for the correct appropriate line of treatment?
Yeah. See, like in Karnataka, the Regional Cancer Institute is Kidwai. So if you want to go for a government institution, Kidwai has in Bangalore, Kidwai has the facilities for doing this. You do have some trust hospital like Shankara Hospital. We do have a missionary hospital like St. John's, which has an oncology unit. These things has to be operated by an oncologist. When it comes to Vellore, you have an oncology unit. CMC Vellore has an oncology unit. And in Mangalore, you have oncology hospitals where exclusive oncology has been done. Like Enapaya has an oncology unit. So most of these surgeries are done in an oncology unit. When it is treated properly at the first time, then the cure rates are very high.
Right.
Especially CA cervix, CA cervix, especially CA cervix. If you try to meddle this, then the patient, what is curable becomes incurable. So please go to the right doctor, get it treated in the right way. That is very, very important.
Right. I think, Dr. Priya, I think it's time that you have to take your flight. Thank you so much for joining us. It's an absolute pleasure and privilege to have you here and to hear those words of wisdom from an absolute authority like you. It's been a pure joy and honor. Thank you.
I want to thank you so much, and His Holiness Tirumeni as well as Achin for having agreed to have me on this show. I'm sorry I have to leave early, but it's time for me to move towards my gate, so I will excuse myself. See you,
Yeah,
Dr.
God bless
Madonna.
you.
See you.
God bless
Thank
you,
you.
man. God bless you.
Thank you,
Thank you,
Tinne.
ma'am. Thank
Thank
you.
you, Dr. Priya.
See you. Bye. Bye.
Thank you, ma'am. Yes, ma'am. So, like Dr. Pallavi Helro Prakara, correct doctor, correct time of the disease, correct management makes a lot of difference. What is cure, what is treatable can mess around. So, please make sure you go to the right institutes. Madam has given you the list of the institutes which have all the facilities that you need for an appropriate diagnosis and treatment and further management. Now, ma'am, one thing is when it comes to the stigma of having a cervical cancer, most women tend to delay the treatment.
Yeah, women delay this treatment because this cancer does not come into the day-to-day activity.
Correct.
Though they have it, they don't have any kind of symptoms. It's not like your appetite is decreased, you're not able to eat, you're not able to do your work. The woman is able to do her day-to-day activity even in the third stage. Even in third stage, the woman can do her day-to-day activity. That's the reason they don't come to the hospital soon. They only come to the hospital when somebody says you have a very bad smell when we come near you. There's something wrong with you, go test it. Or when they have chronic low back pain. Low back pain relating to the leg, when they're not able to do their day-to-day activity, then they come. So even till today, though we have so many facilities, so many screening programs, and we do so many awareness programs, we see in the center of the city like Bangalore itself, 80% of the people come in an advanced stage. They come in the locally advanced disease like second or the third stage. So early stage disease is very few. Only we find about 10 to 20% of them come in the early stage. Rest all are in the advanced stage. That's because woman is able to do her day-to-day activity and she doesn't look sick. She's able to eat, do her work. And I think for most of the women, that is the most important thing. Her health comes as the last and the family comes as the first priority.
No, I absolutely, just like you said, all women put their family, everything ahead, everything, literally everything ahead instead of their own health. And programs like this organized by Bhavana Jyothis is trying to get them to promote and prioritize themselves and their health, so that as long as the mother or the woman in the house is healthy and the rest of the house is healthy and happy. So I think it's time we work on that as well. So, ma'am, one word about how is the recurrence rate? If a treatment eduthu namala, and then what is the success rate of the treatment? Lingi disease, and what is the recurrence rate after treatment?
See, before the recurrence rate, I want to tell all the women that they should not be scared of coming to the doctor of the diagnosis. See, most of them don't come and get it tested because they think, oh, what if I'm diagnosed with something? What will I do? That fear should come out. The fear of diagnosis should come out of them, because if you are diagnosed in an early stage, it is 100% curable disease. So only in the late stages, even second stage also, it is curable, but we cannot operate on those patients. They undergo what is called as radiotherapy. But in the third stage, the chances of recurrence are very high, more than 50%, because it's already in an advanced stage. So there, the cure rate becomes as low as 30 to 40%. So these are the patients where you have recurrence rates are very high in them. So when there is a recurrence, we usually treat these patients in the form of palliation. Like you just cure, you give the treatment for them to push their days or for them to be comfortable without any symptoms. Like we just give them palliative chemotherapy. Even if that is not possible, then the palliative care itself.
So, ma'am, Barnavale, it's a disease with 100% cure rate if detected early. Please, that is a big thing because we don't hear it in a lot of cancers.
Yes.
And when you have a cancer here with us, which is giving us an option to prevent it, fight it, and have a 100% success rate, then the onus lies on us to go for it and get tested and get treated timely with the appropriate people. So, ma'am, another thing is with cancer, a lot of people associate a lot of financial burden. If a cancer vanna and end the chain, it will be financially difficult. It's years of treatment and then years of morbidity. I won't be able to go back to my day-to-day activities. Who will take care of my house? What will happen? These are all the things that play into the minds of women who get who get tested positive for cancer, or rather, like you said, who don't come for testing because they think of all of the things.
True.
So, what are the financial support systems, or where can they get such a treatment where it's not a big financial burden to them or their family?
See, most of the people from Karnataka, if they're having a BPL card, They all come under Vajpayee scheme. So everything is free of cost. The whole treatment is free of cost. Whether it's surgery, whether it's radiotherapy or chemotherapy, everything is given free of cost. And even this is one group of patients who will get free of cost. Another group of people, even if they are not from Karnataka and they are very poor, they have a low income certificate from their respective state or whatever, from wherever they come from the Tahsildar, then these patients are given sometimes 100% concession, sometimes more than 50%. The charges are waived off and these patients are treated.
Okay, that is I think a big message for everybody out there that please realize
And even
there are
Ayushman Bharat also can also have free treatment.
ഇപ്പൊ നമ്മുടെ കയ്യിൽ BPL കാർഡ് ഉണ്ട്, ലോ ഇൻകം സർട്ടിഫിക്കറ്റ് ഉണ്ട് ഫ്രം ദ തഹസീൽദാർ, അല്ലെ ആയുഷ്മാൻ ഭാരത് സ്കീമിൽ ദർ ആർ എ ലോട്ട് ഓഫ് സ്കീംസ് നമുക്ക് യൂസ് ചെയ്തിട്ട് ഇതിനെ ട്രീറ്റ് ചെയ്യാം. ട്രീറ്റ്മെന്റിനെ ഓർത്തിട്ടോ ഡയഗ്നോസിസിനെ ഓർത്തിട്ട് പേടിച്ചിട്ട് ടെസ്റ്റ് ചെയ്യാതിരിക്കാതെ ട്രീറ്റ് ചെയ്യാതിരിക്കല്. There are facilities, there are places നിങ്ങളുടെ അടുത്ത് തന്നെ അവൈലബിൾ ആ. പ്ലീസ് ഗോ ahead and നിങ്ങൾക്ക് അറിയുന്ന ആരെങ്കിലും, if they are going through this, please use this as a forum to gather the knowledge and spread it out, so that there are so many people who can avail this treatment who are not having an access and knowledge how to go about it. Please let them know that these are available and it's free of cost.
And they should also know that they cannot equate each cancer to another cancer. They cannot equate cervical cancer to lung cancer and say, okay, my life is gone. So cervical cancer, endometrial cancers are all curable cancers. They are 99% curable cancer when detected early.
Absolutely, that is true. Not all cancers, like Madam said, are the same, and that is the reason why we are tackling cervical cancer, because
Yes.
know the treatment is there, the prevention is there. So, ma'am, another thing is a lot of people we had a few questions crop up on the YouTube. People are asking if there is any hereditary or a genetic component in cervical cancer.
In cervical cancer, we don't have a hereditary component. As we were talking, 99% of them, in fact 99.5% of them are because of the virus, which is sexually transmitted. The most common transmission is sexually transmission or mucosa to mucosa for close contact. That is the thing. Only 0.5% could be a non-HPV cervical cancer. So it is not a hereditary. It does not run in the families. It is basically mainly because of the high risk factors when they are infected with the HPV virus.
Another question, ma'am. Women who've had a hysterectomy, is there a chance then can they develop cervical cancer?
See, it depends on for what they've had hysterectomy. If they've had any pre-invasive lesions and then had a hysterectomy, these are the patients who need to be followed up because they can have skip lesions in the vault. So they can develop what is called as vault cancers. So if they've had a hysterectomy for a normal uterus, for like a normal benign conditions like fibroid, and their smears are negative previously, then these are the patients who will not have. They are at very low risk of developing a vault cancer.
But the women who've had it for other reasons should get it tested. They shouldn't think that the uterus is out and hence the disease is out.
Yeah, if it's for pre-invasive lesions or if they've not examined earlier properly and if they've had a skip lesions, the pap smears are abnormal previously, then they have to undergo screening even after hysterectomy.
Ma'am, another question that came up on our feed is what happens to pregnancy? Like if they are diagnosed with cervical cancer, is there a future for pregnancy and having kids, and is that a possibility?
Yeah, that's a good question. See, if a young woman has cervical cancer when she's pregnant, it depends how many weeks she's pregnant. Supposing if she is in a very early pregnancy state, then we cannot allow her pregnancy to go because her life is more important than the baby coming out. So if it's in a very early pregnancy, usually we counsel the patient and tell them that this cervical cancer will progress on to, if it is operable, to an inoperable state. So treatment is better. When you start the treatment, then we will not be able to salvage the baby. But if she has had the pregnancy, the cervical cancer detected when the baby is already viable, like, if you deliver the baby is going to be alive, then we wait for the baby to be strong enough to come into this world or deliver, and then only we treat the cervical cancer. So in such cases, we buy time by giving them chemotherapy. So like if she's already in the 6th or the 7th month, we wait for the baby to lung to mature, deliver her, and then treat the mother. But in a very early stage, in the 2 months or the 3rd month, then we cannot wait for that next 3 or 4 months to the baby to be delivered and then treat the patient. So in the 2nd and the 3rd trimester, we always wait for the baby to deliver and then we treat the patient. In the 1st trimester, usually we advise them to undergo the treatment, so the baby will not be viable after that.
Right, ma'am. And ma'am, also, what about the women who've had cervical cancer and who want to have a baby in future? What are we looking at?
No, it depends. If a woman has had a cervical cancer, if she has received radiotherapy, then she cannot have a baby of her own. Before getting the treatment, she has to preserve her eggs. And she has to undergo for surrogacy. She cannot bear the child once she's received radiotherapy. Another condition is if she has a very small growth, less than 2 centimeters, and she has no children by then you can do what is called as radical trachelectomy. That is only the mouth of the uterus, that is only the cervix is removed, uterus is left behind. In such cases, they can have a pregnancy, but then we'll have to put a stitch to the mouth of the uterus because you removed the cervix, it's a very short thing, the chances of abortion will be very high. So we put a stitch and allow the lady to deliver after 8 months.
I think that brings us to the end of the questions on our feed. There are a lot more questions coming in, but you can contact the Bhavana Jyothis team and put it up, and we'll give you access so that you can come up to us and ask questions or email us, and we'll be able to guide you further with that. Ma'am, any take-home messages?
Again, take-home message I would like to tell all the women. See, when you ask, even among the educated crowd, none of them would have undergone a pap smear or a HPV testing. If you can afford HPV testing is the best testing you can do at the age of 35 and 45, because once you do a HPV testing and it is negative, you can go for screening once in 5 years. If you are getting a pap smear done, then once your 3 pap smears are normal, then you can get the pap smears done once in 3 years. Now, this is for the educated group who would want to do a screening, or other women, at least once in lifetime at the age of 35, please get yourself tested.
Absolutely true. Ellavarum, like Dr. Pallavi has rightly said, get tested. Another thing is, I think as mothers, once the vaccine is out, please go ahead and get your kids vaccinated. Vaccine is a big preventive step in cancer. Now, ನಮ್ಮ ಮಕ್ಕಳಿಗೋಸ್ಕರ ಎಲ್ಲ financial education ಎಲ್ಲ ಮಾಡ್ತೀವಿ, but when it comes to health and vaccine, why are we not thinking about it? So once a vaccine is introduced and it's available right here, it's going to be available at cheaper rates and as a part of the protocol by July, as Dr. Priya suggested. Now ಎಲ್ಲರೂ ಹೋಗಿ ನಮ್ಮ daughters-na ಕರ್ಕೊಂಡು ಹೋಗಿ, we have to get them vaccinated. We owe it to them. So, ma'am, thank you so much. It's an absolute joy to have you with us, and thank you for sharing your wonderful knowledge and insights into cervical cancer. Thank you very much.
Thank you. I thank the organization also for giving me this opportunity.
Thank you, Manu. I think you can take it forward from here.
Thank you, Dr. Madonna and Dr. Pallavi. Thanks to Dr. Priya too. We had an amazing session. I hope our audience also learned and are more enriched now. Let's move on to the vote of thanks. I request Tangam Chechi, she is Joint Secretary, Women's Commission Karnataka, to please deliver the vote of thanks.
Thank you so much. I think I have the toughest job. Time is running out. So at this moment, my heart is full of gratitude, and I join the psalmist in saying, give thanks to the Lord, for he is good. His love endures forever. First of all, I thank Lord Almighty for making it possible for us to ideate, plan, and organize this event today on behalf of Women Commission under the Diocese of Puttur. On behalf of the whole team of the Matra Jyothis, I thank our beloved Bishop, His Excellency Most Reverend Dr. Givargis Makarios, who has been our constant pillar of support, encouragement, and motivation for all our endeavors. The success of any event is in what the audience take back with them. And this evening, no doubt that each one of us go back with lots of information, hope, and strength to be able to deal with issues of cervical cancer. I think 2 important messages of the many important messages. One is that we never hear of cancer which can be preventable, That was a big message out of this whole evening's talk. The second, that the vaccines are going to be Indian made, and we know somebody who works so closely with that. I think that was really encouraging. And Dr. Pallavi, for all what she has said about how important it is for women to step out and go for their vaccine. Having such an eminent panel in an energetic moderator has made this a very well invested evening for each of us. Dr. Pallavi, Dr. Priya, and Dr. Madonna, thank you so much for all the time that you have given us. At this point, I cannot not thank Dr. Mercy, who has been from our Singh Sandra church, and Dr. Priyanka, her daughter, who has been our guiding light on how to plan this, whom to call, and helping us to put this panel together. Thank you so much, Dr. Mercy and Dr. Priyanka. And because they were our in-house people, all the three, Dr. Mercy, Dr. Priyanka, and Dr. Madonna, we did not hesitate to go to them with all our needs, all our wants, all our apprehensions, how to plan for this, and thank you for all your time and support. The reach of an event is always critical in gauging the success of the event, and for which we have had immense support from all the Malankara Church in Puttur Diocese, all support from the national and regional pastoral committees, all the directors, secretaries, and the diocesan members of all the commissions, especially Women Commission, Health Commission, and Communication and Media. Thank you for all the support and spreading out this word to all out there. And we see that people have joined in big numbers, both men and women, which is very encouraging. And I think that is another message which was very strong, that this vaccine is not, though it is for cervical cancer, the vaccine is for both the genders. I think that was very, very strong message on how we need men and women to come together to fight this cancer. I would like to thank each one who has participated for this event and accepted and honored our invitation and taken the time out on a weekend of a Saturday to be here with us. There has been a relentless support from our creative team with all the beautiful teasers that you have received, the posters, the announcements at various stages of broadcast. I would like to thank Joel, Joe, and Mobin for their long hours, quick rewards against all odds. Behind the success of Mother Jyothis Puttur Diocese is the leadership, guidance, and support of our young and dynamic Achan, John Puttangandathil. Thank you, Acha, for all your encouragement and valuable inputs throughout. Last but not the least, a big shout out to all the members of Diocesan Committee and all the teams who are part of this community for taking out time to ensure that all ends meet well, and amidst the busy schedule, kids, ill health, exams, we all found time to come together late nights, early evenings to plan for this, and we have had some good fun and learning being together. Looking forward to do many more such events with such a great team working together. Thank you one and all, and have a good evening.
Thank you, Tangam Chechi. Request Tirumeni for the final benediction.
Lord Jesus, you are our supreme healer. Now extend your healing touch on all of us, especially the doctors who were the guiding force behind this, and all the leaders who have taken this initiative to give a greater awareness to many of our beloved children. Now, in the name of God Almighty, bless you, the Father, the Son, and the Holy Spirit. Amen.
Thank you. Thanks for being a great audience today. We overshot time by about 10 minutes. Stay tuned to our Instagram and this YouTube channel, Shantivani. There will be many more such events and a lot of information coming your way. Like Dr. Madonna said, if you have any questions, please reach out to us. We will channel it and get back to you. Thank you and good night.
Yeah, God bless you all. God bless you all.